Many people with diabetes don't realize their heart is silently under threat until it's too late and symptoms are ignored. Your blood sugar isn't the only thing at risk. Your heart, arteries, and circulation are all deeply affected by diabetes every single day. Doctors know diabetics are up to 4 times more likely to develop heart disease, yet most people miss the early red flags. And here's the problem. For diabetics, heart symptoms often appear differently or feel milder than expected, making them dangerously easy to dismiss. You might feel a little tired, or notice slight swelling in your ankles, or even just feel dizzy. Nothing dramatic, but still critical. That's why in this video, I'm walking you through the top 7 cardiovascular warning signs every diabetic needs to watch for. From silent chest pressure to surprising signs like nausea and palpitations, each of these symptoms is a message your heart is sending. By learning what to look for and what to act on early, you can prevent serious damage and possibly even save your life. Don't wait for a crisis. Stay informed, stay proactive, and stay one step ahead of cardiovascular disease. Let's begin with symptom number 1, and make sure you're not missing a warning sign hiding in plain sight. Fatigue is one of the most common and most overlooked warning signs that your heart may be under strain from diabetes. You might assume you're just tired from a busy day, stress, or lack of sleep. But this kind of exhaustion runs deeper. When your heart struggles to pump blood effectively, your body doesn't get the oxygen it needs, leaving you feeling drained and sluggish. In people with diabetes, blood vessels often become stiff or narrowed, making the heart work harder even during simple daily tasks. This isn't the kind of tiredness that goes away after rest. It's persistent, nagging, and interferes with your quality of life. You may find yourself winded just walking across a room, folding laundry, or getting through your normal morning routine. Even after sleeping all night, you might wake up feeling like you haven't rested at all, and that's a serious red flag. Fatigue like this could be your body's way of signaling early heart trouble, especially if you've already been diagnosed with diabetes. Sometimes we chalk it up to age or stress, but these symptoms deserve attention and a proper medical evaluation. If you're experiencing ongoing fatigue, don't ignore it or push through. Talk to your doctor and ask about your heart health. There are tests and treatments that can help you catch heart problems early, long before they become dangerous. Knowing the connection between diabetes and fatigue gives you a better chance at protecting your heart and living stronger, longer. Now ask yourself this: have you noticed unusual tiredness lately? And have you ever brought it up during a medical visit? Also, if this resonated with you, let others know in the comments so they can learn from your experience. Shortness of breath can be one of the earliest and most important warning signs of a heart problem in people with diabetes. You might notice it when climbing stairs, walking quickly, or even just moving around your home, and it feels out of proportion. This isn't about being out of shape. It's your heart telling you it's struggling to meet your body's oxygen demands. In diabetes, blood vessels become narrowed and less flexible, which reduces blood flow and oxygen delivery to vital organs and muscles. When the heart can't pump efficiently, fluid can back up into the lungs, making breathing feel heavy, tight, or effortful. Some people describe it as a feeling of being winded, or like they just ran a mile, even when standing still. It may also happen at night or when lying flat, causing discomfort that interrupts your sleep or forces you to sit up. Many diabetics assume this is just part of aging, or maybe a weight issue. But that delay in action can be dangerous. Shortness of breath, especially if it's new or worsening, should never be ignored, and it always deserves a professional evaluation. If your breathing changes without an obvious cause like a cold or allergies, it's time to check on your heart function. Your doctor can use simple tests like an EKG, echocardiogram, or stress test to see how your heart is really doing. The sooner you act, the better your chances of reversing or slowing down damage before it leads to something more serious. So think carefully. When was the last time you noticed yourself getting out of breath, doing something that used to feel easy? And have you shared that change with your doctor? or kept it to yourself, hoping it would just go away? Most people think chest pain from heart trouble feels sharp and intense, like a dramatic heart attack from the movies. But that's not always true. In diabetics, chest discomfort may appear as pressure, tightness, fullness, or even mild burning that's easy to ignore or misinterpret. You might feel like something is sitting on your chest, or like your bra or shirt feels strangely uncomfortable, but without sharp pain. This difference happens because diabetes can damage the nerves that normally help your body feel pain clearly and respond quickly. As a result, warning signs from your heart may feel dull or muted, making it harder to realize something serious is happening. You could have chest discomfort after walking, eating a heavy meal, or during stress, and mistake it for indigestion or fatigue. Some diabetics experience these sensations during rest or in their back, shoulders, arms, or even their jaw. Not just in the chest. It's also more common for women to have less typical heart symptoms, which often leads to delays in diagnosis or treatment. If you notice any kind of chest pressure that's unusual or keeps returning, don't brush it off. Get it checked by a doctor. Heart-related chest discomfort often builds slowly or comes and goes, but it always means something is wrong under the surface. Your heart could be signaling that blood flow is limited, which is a major risk for heart attack or permanent damage. When in doubt, it's better to ask your doctor and be told it's nothing than to ignore it and face serious consequences later. So ask yourself, have you ever felt strange chest pressure or discomfort and just hoped it would pass without checking it out? And would you know the difference between heart-related discomfort and something like acid reflux or muscle tension? Swelling in your legs, ankles, or feet might seem harmless at first, but for someone with diabetes, it can be a major red flag. This kind of swelling, called edema, often points to poor circulation or fluid buildup caused by a heart that's struggling to pump effectively. When your heart weakens, it can't move blood through your body efficiently, and fluid starts to collect in your lower extremities. Gravity pulls fluid downward, so you'll most often see swelling around your ankles at the end of the day or after sitting too long. For diabetics, this may be worsened by nerve damage and kidney problems, which also affect how your body handles fluid balance. You might notice your socks leave deeper marks, or your shoes feel tight even though your weight hasn't changed. The skin may feel tight, shiny, or unusually warm, and the swelling may go down a little overnight but return the next day. People often ignore this symptom, assuming it's from standing too long, weight gain, or salty food. But that delay can be risky. Consistent swelling could be your heart warning you that it's under strain, especially when it appears with fatigue or breathlessness. If you notice this symptom regularly, even if it seems mild, it's important to talk to your doctor and get your heart evaluated. Managing diabetes means being alert to these signals. The earlier you catch cardiovascular issues, the better your outcomes can be. Keeping a symptom journal can help you track patterns and give your doctor clearer information during checkups. Have you noticed swelling that comes and goes in your feet or ankles? And did you ever connect it to your heart health? Have you ever asked your doctor whether your swelling might be more than just tired legs or water retention? An irregular heartbeat, or the feeling that your heart is fluttering, skipping, or racing, can be a critical warning sign in diabetics. These sensations, known as palpitations, may feel like a sudden thump in your chest, a fluttering in your throat, or even light pounding. For people with diabetes, these symptoms may indicate that the nerves regulating your heart's rhythm are being damaged or overstimulated. Diabetic autonomic neuropathy, damage to the nerves that control your heart, can cause abnormal rhythms or mask the usual warning signs. You may not feel chest pain or pressure, but your body could still be sending subtle clues that something is out of sync. Some people feel palpitations during rest or after small amounts of exertion, like walking or climbing stairs, and assume it's anxiety. But when your heart rhythm becomes irregular or too fast, it can reduce blood flow and oxygen to your brain and muscles. This can lead to dizziness, fainting, chest discomfort, or even increase your risk for stroke or sudden cardiac events. Diabetics are especially prone to a condition called atrial fibrillation, a type of irregular heartbeat that often goes undiagnosed without testing. If your heart feels like it's racing or skipping beats for no clear reason, don't wait. Schedule a heart screening as soon as possible. Tests like an EKG or Holter monitor can detect issues early, even if symptoms only happen once in a while. With treatment and proper management, many heart rhythm problems can be stabilized, helping you avoid serious complications down the line. Have you ever felt your heart beat strangely, then dismissed it because it passed quickly or didn't hurt? And have you ever asked your doctor whether your blood sugar might be connected to how your heart is behaving? Most people don't realize that heart problems in diabetics can show up as stomach issues, like nausea, indigestion, or even mild bloating. It's one of the most misleading warning signs because we often associate these feelings with food, stress, or minor digestive issues. But in reality, your heart and digestive system are closely connected, especially when your nerves and blood vessels are affected by diabetes. When your heart isn't delivering enough oxygen-rich blood to your body, your stomach can become sluggish, irritated, or inflamed. You might feel a persistent upset stomach, a heavy or full feeling after eating very little, or unexplained nausea at random times. In women and older adults with diabetes, these symptoms are especially common and are often mistaken for acid reflux or anxiety. Some people describe it as mild heartburn or chest pressure that doesn't go away with antacids or dietary changes. Others feel sick during mild activity or stressful situations, which may indicate reduced heart function under pressure. What makes this tricky is that the symptoms are subtle, and they don't always appear during a dramatic moment, like exercise or exertion. Instead, you might feel unwell while sitting, eating, or resting, making it easy to dismiss or mislabel. But nausea that comes without explanation, especially in someone with diabetes, should always be investigated for possible heart involvement. If your doctor knows you're diabetic and aware of these symptoms, they can order the right test to rule out cardiovascular risk. Have you ever experienced unexplained nausea or indigestion and assumed it was something you ate or just everyday stress? Would you recognize the difference between digestive issues and a possible heart symptom if it happened again? Feeling dizzy or lightheaded might not seem like a heart problem at first, but in diabetics, it can be a serious warning sign. When your heart isn't pumping enough blood to your brain, even for a few moments, it can cause a sudden drop in alertness. You may feel like the room is spinning, your legs are weak, or you're about to faint, even if you're just standing still. For people with diabetes, this can be caused by narrowed arteries, low blood pressure, or poor circulation linked to heart disease. Your body depends on steady blood flow to keep your brain sharp and your balance stable, especially when you move quickly. Standing up too fast, bending over, or even taking a warm shower may trigger lightheadedness if your heart is under stress. Sometimes it's also linked to blood sugar levels. But recurring dizziness may signal something deeper, like early-stage heart failure. In some cases, the dizziness may come with shortness of breath, palpitations, or blurred vision, which requires urgent attention. It's easy to dismiss these episodes as fatigue, dehydration, or not eating enough, but your heart may be struggling in silence. If you're having regular dizzy spells, even mild ones, your doctor needs to know. They can evaluate both heart and circulation health. Simple tests can check your blood pressure, heart rhythm, and oxygen delivery to help rule out dangerous conditions. As always, awareness is your best defense, because these subtle symptoms can lead to major complications if ignored. Have you ever felt dizzy and assumed it was nothing? And would you recognize it as a possible heart-related symptom today? Have you discussed dizziness with your doctor or kept it to yourself because it didn't seem urgent at the time? Now that you've heard the 7 cardiovascular red flags every diabetic should know, take a moment to reflect on what you've just learned. These symptoms, fatigue, shortness of breath, chest discomfort, swelling, palpitations, nausea, and dizziness aren't just random health annoyances. Each one is your body's way of signaling that something may be wrong, and with diabetes, those signals matter more than ever. Heart disease remains the leading cause of death in people with diabetes, not because it's inevitable, but because it's often caught too late. But here's the good news. When you know what to look for, you give yourself the power to take action early. By paying attention to subtle symptoms and reporting changes to your doctor, you increase your chances of preventing long-term heart damage. Every step you take, whether it's checking symptoms, getting screened, or simply staying informed, helps protect your heart and your future. So don't ignore what your body is telling you. Talk to your healthcare provider about any symptoms that match what you heard today. If even one part of this video helped you recognize something in your own health, that's a powerful first step. And if you found this valuable, be sure to subscribe for more videos like this, focused on protecting your life with diabetes. Leave a comment sharing which symptoms surprised you the most. Your story could help someone else catch a danger sign early. And don't forget to like and share this video. You never know whose life it might save today.